go to the first slide and I'll share with you who's coming today. So just a quick reminder that the meeting's being recorded and it'll be shared on social media afterwards, but please do ask questions if you want to do that. Next slide, please. So we've got the data update from Anna, as usual today, and we've got a vaccination update from Darsha, and we also have Emma Smith, our health protection lead, on the call to support with some of that information, and Andrew Vox, who's leading on some of the comms around vaccination. We've got Councillor Jessica Carrington today here with us, and then we've got a few smaller updates around the COVID Memorial and the Caring Through COVID Awards. And towards the end of the meeting, we'll be welcoming Lisa Chandler to give us a long COVID update, and we'll be giving a little bit of time to that discussion. So without further ado, I'll hand over to Anna to share the update about the data. Thanks, Anna.
Thanks, Kerry. So what you can see here is the slide that we usually show, and you can see that we've sort of seen that. We've basically seen that number move around between around 350 and over 400,000 cases over the last few weeks. So it's kind of it's not looking, it's certainly not going down. Next slide, please, Kerry. So what you can see as well is that on top of our rates remaining sort of fairly high, our positivity rate, so just for those of you who haven't been on this call before, that is for every 100 tests that are sent off, what percentage come back as positive tests. And you can see that Wakefield's a little bit above the West Yorkshire and England average at around sort of 12–13% of all tests. And that is significantly higher than we'd want it to be. You may remember us quite some months ago, we were well below the 5% mark, and that's really where we'd want to be. And that indicates that we do have those sort of high rates of infection. We also look at positivity by age group, because that gives us a sense of kind of what's happening within our different sort of age groups in the district. And what you can see is that some of those age groups, particularly the kind of 11 to 18 sort of but the sort of older, the younger cohorts have got extremely high positivity rates. So you know, 50%, and that is way higher than we'd want it to be. So that's sort of indicative of the slide. You'll shortly see the slide I show you where it is that sort of slight indrawing of breath, where you see what high rates we've got within that younger population particularly. Next slide, please. So again, sort of just looking at our testing rates, and you can see that our 17 to 18 year old, there was that bump there. So when children, so some of that's around people going back to school and doing those lateral flow tests. And then what happens is they'll get a positive lateral flow and they'll have a PCR test. And over the summer, perhaps people haven't been doing as many lateral flow. Well, they probably won't, but they've all got to do them to go back to school. So that green line that you can see going up, that 11 to 16 line, we're finding those cases in those age groups. Next slide, please. So this is the slide where you sort of breathe heavily, because you realise that we have got those very high rates within certain age groups. So we've particularly seen that sort of 17–18 age, of having those up to sort of over 1,000 per, well, that you can see there that's unvalidated data, but that 1,249 cases per 100,000, which is extremely high. And even worryingly in our sort of over 80s, which for a long while there was naught. We had a rate of naught in those age groups. You can see that's quite high as well, so 153 per 100,000. And these are sort of predominantly vaccinated communities. So what we know is people are still, you know, even with 2 vaccines, obviously it has a huge effect on hospitalisation and deaths. But it doesn't necessarily protect you from the virus. And something we've just been hearing from Public Health England, which is probably really worth some of you who work with older people for reflecting on, is with flu, we know that children are super spreaders. So you get children who will spread flu to lots of people, but what they're finding is actually older people, even if they're double vaccinated, can be what we'd call super spreaders. So really this really strong message is, if you've got people coming to groups who've got a sniffle or any symptoms at all, they should be really cautious and they should stay at home. So really trying to reduce that transmission. So next slide, please. So again, you know, this isn't going the colourway that we want it to. You know, you can see those darker patches where we've got much higher rates, you know, over 400 per 100,000. And again, you'll reflect on when I've shown you this a number of months ago, how that was, we were starting to see areas which were so low that we couldn't actually show the figure, and they were suppressed areas, and we're not seeing that now. And you know, it's hard to say what will happen to make those rates go lower, given that we don't have any restrictions. So you know, there's not a lot we can do really for those to go down, apart from obviously continuing to vaccinate, etc. Next slide, please. So just we show you this around long COVID. It's quite interesting. I think Lisa's going to be talking about long COVID later, so I won't go into it too much. But we take this as a percentage of people who have COVID, and obviously it's really important. Again, I'm sure the people that you work with, the people you're interacting with, that long COVID is a very difficult thing for. And you know, it impacts on children as well, on our community. You know, I won't say any more because I don't want to steal Lisa's thunder, who I know is speaking to us later. Next slide, please. Hospital admissions again, so you'll see that that's a quite nice slide to show you the vaccine effect. So you can see that when we had really, really high rates with no vaccination, sort of November, December time, those extremely high levels of hospitalisation. Now, even though we've got very, very high rates in our communities, actually you can see that those admissions are still remaining low. But given the huge pressure our hospital system is under, and I was watching Look North last night, and it was talking about waiting lists and all of those things. Even just a small number of additional cases in hospital has an impact. Next slide, please. So again, with deaths, we were at a 0 death place for a while, but now we have seen some of those deaths go back up. Again, much lower than we were seeing pre-vaccination, but obviously very concerning and very, you know, you always have to remember that, you know, behind every death there's a family, friends, you know, community, and that it's, you know, it's tragic. Next step, please. Sorry, next slide, please. So again, I think this just kind of shows you, it's a great slide. I think Paul might have shown this last week, but around the impact of the vaccine. So the blue line is the number of cases we've got, and you can see incredibly high number of cases. The cases in the 60 plus age range are much lower, but still tracking up. The death, where the black line and the red line, which is the number of inpatients and deaths, you can see that those, rather than tracking cases, those with the vaccination, they go right down. And that, you know, it can feel frustrating, I think, for all of us, that even though some people double vaccinated, they're still contracting COVID. But when you look at that graph, you realise that the impact is much lessened. And so, you know, that's a really important message to continue to get across. Next slide, please. So again, we just show you these figures at the end, and you can see that you know, it is fantastic that 235,605 people in the district have had the 2 doses, and you know, we're getting those rates up. I actually think those rates are pretty good in that 18 to 29 age group. We know from our sort of the marketing we've done and the engagement we've done with young people, that for some that, you know, it is making the case in a way you don't have to make with older people. So I think that is actually still really good. Next slide, please. Yeah, I'm not going to do that slide actually. Kerry, do you want to just go? I think we had that one last week. Yeah, so that's the end of those slides. I think we'll probably take questions at the end because we've got quite a lot to get through. And actually, I'm afraid I've got another meeting, so I do have to go. But my team are on, so they'll definitely be able to answer anything that you need.
Thanks, Anna. Really appreciate that update. Really interesting as ever. Thank you for that. So can we take the next slide, please? So we have got a vaccination update later on, but I just want to pause for a moment and introduce Councillor Jessica Carrington, who I know is going to talk to the next couple of slides, because we're really aware of the other impacts of COVID on our communities, and this is a great initiative. So over to you, Councillor Carrington.
Thank you. Hello, everyone. Thanks for inviting me on today. Really appreciate it. Just want to give you a little bit of information about myself first of all, and then obviously take you through Take 5. So I represent Ackworth, North Empsall and Upton. I'm the Deputy Portfolio Holder for Community Health and Poverty, and I'm the Council's Mental Health Champion, and I'm also the Hate Crime Champion and the Carers Champion. So I've got quite a busy schedule of work what I dip in and out of, and try and support where possible. So Take 5, it's been my initiative which has been born out of COVID. Spending all the time working from home, I wanted to think about how it was going to start impacting on people when people start going out and about. Obviously mental health is such a massive, important thing that we need to deal with at the moment, and put support out there in the communities and keep raising awareness. So Take 5, it's literally for anyone out who's going out and about, who may feel a little bit overwhelmed, anxious, and they're just trying to take some steps steady away to get out and about again in the communities. The initiative is just to provide some safe spaces around the district. We've tried doing a pilot, which has been successful. We're looking at moving forward, doing it in different phases. So the Take 5 is being rolled out with the PCSO, so the police are involved with it. They've been very supportive of the initiative. We've had the libraries involved as well, which has been great. We've started rolling it out into the leisure centres, the museums and cafes. So basically, if someone's out there and they're having a little bit of an emotional moment, then we want them to take 5 minutes out. So if they see the stickers out and about, for example, if they see the sticker in the library window, they know they can go in there, introduce themselves if they want to the staff, because the staff are aware of the initiative. They've got a badge on or a lanyard or a face mask with the logo on, and it's just about giving a bit of help and support to that person in need at that moment in time, just letting them have 5 minutes out somewhere safe, asking if they need anything. So it could be they might just want a family member to be contacted, and that's something what we could provide for them. So it's just giving that little bit of extra support out there. If I can have the next slide, please. So obviously I've touched on quite a bit of this going forward with it, and we're going to be raising the profile a bit more now. A couple of the phases have been implemented, so we're going to be looking at putting a lot more social media out there, raising awareness, and keep rolling it out. We're looking at charity shops, we're looking at rolling it out into the hub. So yeah, we're moving forward quite nicely with it at the moment. So if you can just put the next slide on, please. So this is the list of libraries where Take 5 is already out there at the moment. You can move to the next slide, please, for me. Take 5 is also going to be promoted with the Let's Keep Moving campaign, and also the Be Kind element of it, with all the messages. As you can see on the slide, the logo is the heart with the number 5 in the middle of it. So it's quite simple, effective, and it is recognisable. If you do want to find any more information out of it about Take 5, obviously please contact me. I can give you some more information. There's also links to the YouTube video, a bit more about it, and there's some links to the Wakefield Council website where all the information is there. All the support people will be given, there's QR codes where we can get somebody to scan the QR code and it'll take them to more services. So you don't have to be a mental health provider or anything to be involved with this. It's just about providing somewhere safe for that person what's having an emotional moment, and just supporting them through it, basically giving them a listening ear. Thank you. If there's any questions, I'm happy to take them.
Thank you, Councillor Carrington. That's a fantastic initiative, and we definitely will share it with our community champions and ask that people share that on. Are there any questions? Any comments? Anyone want to give any feedback about how this might work in their area or with their friends and family? No, okay, that's fine. So we do encourage people to share it, and thank you ever so much for coming and taking time to talk to us about this initiative, which is really, really important. Okay, if we could move on to the next slide, please. We've got a number of different people going to give us updates about vaccinations. There's been different information come through at different points over the last week or so. So Darsha, I think you're going to talk to this slide, and then we've got a few more slides around yesterday's updates.
Thank you. So the first one is around boosters, and as you know, boosters have been put forward and recommended for those who are most vulnerable to COVID, and it is to maintain high level of protection. This is the same group, if you cast memory back to the beginning of the vaccination program, who were jabbed in the phase 1, and we will be looking at deploying the vaccination program in the same order. So starting with those who are the old groups within that cohort. In terms of what to expect, it's the earliest that this can be given is 6 months after your second dose, and we are aiming for the protection to be highest during the coldest months of winter. I know Anna and Emma have spoken around flu and perhaps how slightly different it might be this winter to how it was last winter. The vaccine, one of the questions that we had in the past, which vaccine would I have? And it will be one of the mRNA vaccines, which will be either Pfizer or Moderna. And in terms of those who may have been or may have allergy to either of these two vaccines, AstraZeneca would still be given and still will provide a good result. One of the questions again asked in the past was, could the vaccine be administered at the same time as flu vaccine? And yes, they can be given at the same time. We have had confirmation that this will not affect efficacy, but it is in terms of operational practicalities that we are able to give the vaccines at the same time, but we need to have a look where it is possible to deliver it. In terms of recommendations for the booster, this phasing out of or rolling out of the booster campaign doesn't necessarily imply that we'll have boosters every 6 months. It is really very much a decision that is based on the current position and where we are at the stage of the pandemic. Also, at the moment, it does not imply that we will be looking at those who are 50 and under. Flu vaccine that I've mentioned, we would encourage everyone to come forward for flu vaccinations when the invitation comes. So for those, especially if you are working with older populations, if you could encourage anyone to take up that offer, that would be fantastic. In terms of 12 to 15-year-olds, we've spoken in previous weeks that those who are 12 to 15 clinically extremely vulnerable would be offered the vaccination. This builds on it in terms of all 12 to 15-year-olds being offered an opportunity to take this, take the vaccine. It would be Pfizer, and it would be via invitations from the NHS and with parental consent. So the offer is being opened up for parents and children and young people to consider. One of the things to also highlight are third doses. So in terms of booster sessions and third doses, these are slightly different. The third dose is being recommended and offered to those who are severely immunosuppressed, and it is to ensure that their immunity continues through the months. And the NHS consultants have been asked to contact patients who are on their list. So either consultant or GP will contact patients who fall within this category, and that will be starting from mid-September. So these are the 3 groups that have been updated in the last a week.
Great, Darsha. Thank you very much for that update. We've got some more slides now. Do please consider your questions as we're going through. That's a really good overview.
Kerry, I think they're my slides next, or it's ones that I'm going to speak to certainly. Just whilst they're displaying, because I can't quite see anything on the screen at the moment, just picking up on what Dasha said around third dose or booster dose vaccinations, in particular for those over the age of 50 and those that are in a clinical at-risk category, and the flu message. It's really important that we promote that people don't delay their flu vaccination this year, and because in terms to receive your third COVID vaccination, you need to be 6 months since your second dose. So there will be individuals that will be invited forward for flu, but won't be ready for their third COVID vaccination boost. And what we want to avoid is people waiting and saying, I'll wait and have them together. It's really important that we encourage people and promote the message of, if you get invited for your flu dose, have that as soon as you can. Because what we want to do is help people be prepared for winter. And just add some context to that is that last year we didn't have a lot of flu circulating within the community, almost none. We had a lot of measures in place like face masks, social distancing. We had no mixing of groups and people. And it's great that we're sort of getting some of that normality back. But what that means is that we're more likely to see flu cases this year. And because we haven't seen much flu in the southern hemisphere, and what happens each year when it comes to flu vaccine is we look at what happens in the summer hemisphere for their flu season, and we look at the viruses that have been circulating, and what we do then is we make a flu vaccine based on those viruses. And it is that vaccine that we then receive for our winter period based on the viruses that were in the southern hemisphere. So what our real risk and public health concern is this year is that potentially our flu vaccine might not be as effective as it has been in previous years. But we really hope it is, and that's because there hasn't been much flu. And couple that with the fact that people haven't had much flu exposure last year, because of all the social distancing, the mask wearing, and all of those other COVID measures that we had, there is a risk that we might see more flu cases. So that is really why it's important that people go and get their flu vaccine as soon as possible. So that's my flu sales pitch, and we can have some questions on that later. But this is sort of the COVID autumn winter plan that we've seen published yesterday nationally, and sort of outlines some of the detail in that. So it's a sort of reinforcing that message is that we're in a position where we're learning to live with COVID, which is why we've seen all the mitigation measures and the changes in terms of lockdown not being our first line of defense, and very much dependent on the vaccine program and all that we've achieved so far. And we can see that in the data, and the third dose or the booster campaign is about being extra precautious, ensuring that we're protecting ourselves to the maximum that we can as individuals and as our communities and our families, and really ensuring that we're protecting ourselves against the COVID virus, and not knowing how our winter might be, and obviously trying to help our NHS services deliver the services that they can in terms of routine healthcare, as well as trying to help those cases of COVID that do actually unfortunately end up in hospital. It's about our test, trace and isolate system, that is going to be really, really important. And, you know, finding cases of COVID, those people isolating, then help stop spread that infection. We heard Anna say in terms of our older age groups being our super spreaders, because what we know is when you're vaccinated you often have mild symptoms, and even with mild symptoms you can pass the virus on to others who may or may not be vaccinated. And so it's important that we respond to mild symptoms and have our PCR test irrespective of sort of it just being a minor cold, or let's just make sure that we're confident that it isn't COVID. It's about sort of working through reducing and then reinforcing the benefits, and sort of reinforcing the fact that, you know, we don't want to see people go into hospital, and we don't want to see people sadly pass away. And we know at winter time that generally happens as well with the more vulnerable, just because of extreme colds and other illnesses that are circulating as well. And we know that the vaccines are highly effective against the Delta variant, which is the dominant variant. And what we want to avoid is sort of any changes to that in the future. Next slide, please. Sorry, that might be just, thank you. And so I've talked about some of this already. It's about supporting the NHS, it's about supporting social care, and it's about protecting our friends and families and our communities. And also within the winter plan is about how we support the vaccine rollout internationally and how we support our other neighbouring countries and worldwide to achieve at least one dose of the vaccine, and the benefits to that for the economy and businesses and movement of people as well is really, really important. It's about, we've been through this in terms of the age categories and the new recent JCVI guidance of who's now going to be eligible. We're hoping to see that play out in Wakefield in terms of starting those invitation process in the next few weeks, and certainly starting to see the school-based 12 to 15-year-old program make a start as well. And I want to reassure people as well in terms of the school-based for COVID. The NHS has a long history of delivering school-based programs, a long history of working with parents about obtaining consent and understanding the information and helping them make informed choices for those children. And flu vaccine again is another common program delivered in schools that families will be familiar with. Next slide, please. Is that the last actual slide? I think the other thing to comment just within the winter plan is what might be the plan B. So obviously plan A is sort of everything is a business as usual, living with COVID. Plan B is sort of what happens if it's not as good as we thought, and we have more cases of COVID and we see hospital admissions rise, and sadly we see deaths rise. We get a bad flu season. So we've seen where that there might be measures about making face masks again compulsory. I mean, it's no harm for us to continue to wear face masks. We might see sort of social distancing, sort of home working measures be sort of introduced or mandated on that national level. Again, it's no harm for us to follow some of those practices. Sort of just because you can do something doesn't necessarily mean you have to, and it's about that individual risk and managing that for you and your family and your community, and sort of just thinking, just because you can, is it something I should do? And if the answer is yes at the end of that, then that's fine, but you've already done that internal risk assessment. We'll continue to see the use of lateral flow testing, and that's the asymptomatic testing, particularly in our school settings and within our other community groups, and sort of, that'll be continually monitored over the course of the days, and we'll still continue to see sort of the support for self-isolation. I'm going to pause there because I'm doing a lot of talking. I'm conscious of time, and there's other people that have to talk.
Thanks, Emma. There are a couple of questions in the chat that I want to just draw people's attention to. One is about information on pop-up sessions, so we can direct people. And you are still able, is it over the age of 16, to go into any of the flu centres, any of the vaccination centres under the Grab a Jab logo. So we've put that link in the chat, and we'll do a little kind of screen grab of that and circulate that round. And there was another question about pharmacies offering flu vaccinations. I don't know if you know the answer to that, Emma.
Yeah, so as well as GP practices that can provide flu vaccinations, pharmacies can provide flu vaccinations that are eligible under the National Flu Programme. So that's in anyone in a clinical at-risk category, anyone sort of over the age of 65, health and social care staff, and that can be provided free. But there are some people that can't actually have it under the National Flu Programme and have it provided free, but pharmacies will actually give you a flu vaccine, and you can pay for that. And that charge with vaccine varies from pharmacy to pharmacy, so you can do a bit of research. One pharmacy might charge you £8, another pharmacy might charge you £12. So if you're not in that group, so I'm not in an at-risk flu group, and I go and have my flu vaccine and I pay for that and have that at the vaccine at the pharmacy. So that is another alternative for those that might want to have their flu vaccine but not necessarily eligible for it.
That's great. Thank you very much. There's a lot of information there around what might happen next. Have we got any more questions? Would anyone like to ask any questions verbally as well as just on the chat?
Kerry, can I just add a couple of things from a comms point of view?
Absolutely.
Is that okay? Hi everybody. Firstly, on the 12 to 15 vaccinations, after careful consideration and having sort of taken advice, we've actually decided not to proactively promote 12 to 15. We will provide information, but it's just because obviously there's quite a lot of sensitivities around the JCVI not having really endorsed it and parental consent and stuff. So whilst we will, provide information, we're not doing any active, encouraging people to take uptake and everything. It is quite the opposite on the booster campaigns. I am pulling together an active communications plan to get messages out about boosters. So I just wanted to say to everyone, particularly those who work with sort of older people, if you have any routes that we can use as channels for the communications. So, if you know of any newsletters that go out to groups that represent some of the older people, maybe groups who organise meetings for older people. I don't know if things like sort of, the sort of lunch clubs and things for older people have started again for COVID. But anyway, we can put up posters. So any sort of channels we can use will be really, really welcome. And then I know I've mentioned it before and a few people have already replied and responded, and thanks to those. But we will be doing another sort of video and social media campaign, looking for people saying, I will have my booster so that I can, whatever it might be, or I have had my booster so I can, whatever it might be. So again, anyone who could volunteer for taking part in that. So brilliant, thank you, Amanda. Yeah, I'll get back in touch, and I know we've sort of discussed it already, but thank you very much. So yeah, just a plea for help with the comms on the boosters really, and an explanation of our position on the 12 to 15-year-olds.
Thank you, Andrew. And I think it's right to be sensitive to people's questions and concerns. Emma, would you like to come in and answer some points there as well?
Yeah, I just think there's something about a bit of myth busting as well, and this group being part of that, particularly when it comes to sort of the 12 and 15 year age category, and totally acknowledge that it's informed consent and choice, and just the interpretation of what the JCVI actually did say. So what they did say is that the health benefits was not as great as they would have wanted for them to endorse a whole population campaign aimed at 12 to 15 year olds. What they said is the benefits are marginal, so they weren't as great as we would like to see when we're trying to do a whole based program, but there were still some benefits, and the potential harms were slightly that we weren't really known to the scale of the potential harms, and that there were some harms, but they didn't outweigh some of the benefits. And I think that's really important. And the JCVI based their decision making on health alone, and I think it's important for us when we're considering the COVID vaccination for our 12 to 15 year olds in particular, that we consider sort of the other implications in terms of their impact on education, their impact on how transmission of the virus within the community and their own families and their own households. And we're all very aware, and we've talked about this in numerous forums and community groups, sort of if you have a good education and good grounding, that leads to go on to a better life in terms of career and education and other opportunities. So it's also that long-term impact that happens if you don't actually have that continual engagement with education. We've seen over the last 18 months, we've had a lot of disruption. So it's important that the government's advice has been based on a whole host of other factors as well, and the JCVI is a pure clinical view, and it's important, I think, that we take that in the round.
Thank you, Emma. That's a really good summary. And please do let us know, community champions, if you hear of any conversations where you think we can add a bit of information, add clarity, get our messaging a little bit more, you know, accessible and meaningful to people who you're having conversations with. So please do keep in touch with us. There's a question in the chat, Emma, around COVID vaccinations and flu vaccinations, and whether shingles vaccinations for people turning 70 is continuing. Do you know that?
So all routine vaccinations for anyone that was eligible will continue. So if you're eligible for your shingles vaccine, you will get the invite as you normally do through the NHS. So there's been no immunisation programme stopped. We would continue to encourage people to have all their eligible immunisations, and that goes for the school-based ones like HPV as well, and flu and the boosters within the school-based campaign. It's really, really important, because what we know is it eradicates infection, it eradicates disease, and that's why we've ended up in the position where we've got a COVID vaccine to help reduce the COVID cases and hospital admission and deaths.
Thank you. So I think we're coming to the end of our vaccination update. Has anybody got any other questions? So I have one final question, which is, what should people do next?
In terms of the COVID vaccination?
In terms of if you want your COVID vaccination, do you need to make an appointment? Should you wait for a message from your GP? Should you wait for the national booking system? Do we have that information yet?
Dasha might have that detail from the CCG perspective. Dasha, is there anything you want to add?
It is actually detail that we are working through, so we hope and we'll be able to share it as soon as we can. So once we get that, we will share it with community champions. We are anticipating the information will be going out, aspects of which will be shared on our website as well. So we'll be making available, like we did with the drop-in clinics or walk-in clinics, where booster is available as well. So we will share, we're just working through the operational aspects through it. So we will share when we can.
Thank you. I'm going to guess, Dasha, that it would be preferable for people not to be ringing their GP today or tomorrow to ask about that.
Absolutely.
Absolutely. And as I mentioned in the initial slides, we will be going through the programme like we did previously. So at the beginning of the vaccination programme, we went through the cohort, and we will work through the cohort. And Emma really nicely summarised in terms of the age groups, but also that it includes those who are clinically extremely vulnerable. So we're going back to the 16 to 64 year olds clinically vulnerable, but we will go through the sort of timely order of the age cohorts as we did previously.
Brilliant, thank you.
Sorry, Kerry, I know you want to move us on, but we need to do the age cohort in that way, because that factors in this 6-month period I was talking to you about. So, you know, if you're not within that 6-month window, there's no benefit to you phoning your GP. We just create a blockage in the system. So my perception is that people will receive an invitation like they had done previously, and they'll be advised not to contact the GP till we get later on in the programme. But as Dasha says, we'll wait that clarity.
Thank you, Emma. And I do want to move us on now, if that's okay. Community champions will let you know as soon as we've got any more detail for you. So Andrew, do you want to mention, do you just want to summarise what you're doing with this slide?
Yeah, really. I mean, that's it's sort of the campaign, the Let's Keep Moving campaign, talking about, obviously, whilst restrictions have been lifted, just to consider, you know, taking care of each other, yourselves and each other. And this is just going back to the idea of, you know, using images, using real people to talk about, you know, why they're doing whatever they're doing. So, for example, here you've got, you know, we've got our jabs for a brighter future for our family. We meet outside to help keep COVID away. And this is part of our ongoing campaign, as I say. We'll be doing the same thing with the boosters, why people are getting boosters, why people are getting vaccinated. And we think just introducing sort of, you know, real life people and real life emotions will help with those communications.
Thanks, Andrew. Much appreciated. Okay, can we go to the next slide? Tracy, do you want to take us through this, please? We did mention this last week.
Yeah, thank you. And it was just a reminder, really, because I was on holiday last week and just wanted to make sure that everybody got an opportunity to be involved, that a memorial will be designed and erected in the Rose Garden Lawns Park to honour and memorialise the loss and struggle that has happened around our residents, communities and our care workers. An artist will submit their proposals for a design, and our COVID champions have been given an opportunity to be on the panel that has a look at all those designs and chooses the chosen one, which I thought was a great opportunity. So I'm not sure if anybody did come forward from last week's, but if anybody is interested, no, they didn't. Oh, if anybody is interested, please do contact us, because this is a wonderful opportunity for our COVID champions to have a really significant part in choosing that. So please do come forward if you can. Oh, and I understand, Kerry, that you told me that we're going to be having a tree planted in each ward as well.
Yes, we are.
The memorial to COVID, thank you. And this one, Caring Through COVID Awards, I think this has already been circulated as well, but it's just a reminder, please, that we do have some short lists of people that you can vote for. So there are the links on the slide. So please do vote for your preferred option. Thank you. And here's one hot off the press that I think Andrew might want to say a few words about.
Yeah, just on the subject of awards, we entered the COVID Response Awards, and we've just heard this morning, we're really pleased that Wakefield Council has been shortlisted as a finalist in the category of the awards, which is the best COVID response involving the public sector. So we put together a detailed application about the work we've done across the district, engaging the public sector, and the response we had. And as I say, we've just heard this morning that we've been shortlisted. And we've been invited down to London on the 25th of November for an awards ceremony. So fingers crossed. And obviously, you'll be hearing more about how that proceeds and how we end up there.
And what I would say is that our response in Wakefield has been very much led by and in partnership with our communities. So thank you to everybody. It's not a public sector effort. It's an effort on behalf of everybody that we've worked with. Thank you to our community champions for being part of that effort. So we've got a couple of people who have volunteered to be part of the panel. So I'll pass those on to you. They're in the chat. I'll pass those on to you, Tracy. And I know Bob says that there's going to be a tree planted next to the cherry tree near him, which is great, and that will provide a space for people to come, you know, a focal point if people need to come and reflect and have a moment in each area. So I think it's really important to remember. Okay, so thinking about long COVID, we know that this is a topic that we've had a presentation on previously, and there was a quick slide earlier on in the presentation around just the numbers of people who might experience long COVID in Wakefield District. Obviously, this is a really emerging area, and we're really happy to have Lisa here today, although she's just said that her mic isn't working. Lisa, do you want to log out and log back in, and we'll hang on a couple of minutes for you? I'm not quite sure what else to suggest there. Okay, let's see if Lisa's coming back in again and see if that works. And I have to say, I don't think I could cover for Lisa and talk to these slides, so.
Yes, it appears to be working, and nice to see you. Quarter past one on the dot, so it worked in the end. Yeah. Hello everybody. Lisa Chandler. I'm public health principal, and I work at Wakefield Council, but also work with the GPs and the sort of the health team over at Wakefield CCG. I came a couple of weeks ago to talk about long COVID, and if anyone's got any questions, if they put the hand up or pop them in the chat, and I'll answer them at the end if that's okay. So just wanted to come along today to give you a bit of an update on where we are now around long COVID or post-COVID syndrome. One of my worries is that when you talk about something being long, it's quite depressing, and it makes people feel that it might not ever be cured. But what we're finding out more and more is that with long COVID, we are seeing people recover and be better in the majority of cases. So just can I have the next slide, please? Yeah. So just looking at the update, the adult post-COVID assessment and treatment service at Mid Yorks is now up and running. They've had 245 referrals so far. The majority of those people have gone on to need some either psychological support or some support around fatigue management, or sometimes breathlessness. And the breathlessness has mostly been something that, again, physiotherapy has been the cure for, rather than inhalers or medication. So that's a really sort of important thing to know and to look at. That it can be managed, and it doesn't always mean drugs. Very few people have needed any medical treatment from consultants, and I think we've only actually had 10 people need to be discussed at this sort of bigger multidisciplinary team meeting with consultants, and of those, only 4 of them needed to go on and see a medical consultant, and that was for more the neurological stuff, so the sort of the headachy symptoms and the dizziness or any symptoms with pins and needles, things like that. So very few people have had to go on and have actual medical treatment. One of the things we are still sort of concerned about is that perhaps not enough people are coming forward, and we are looking at where referrals are coming from. So we're looking to see in which communities and in which areas we're getting most of the referrals from. We are getting quite a lot of referrals from sort of the 2 most deprived populations in Wakefield, but we do think we need more. So we need to be making sure people are aware of the symptoms of post-COVID. We need to make sure that if people do have those symptoms, and I'll put the little drawing on again with some of those symptoms, because they can be very varied, they can change a lot, they can be different from day to day. But if people are getting these symptoms, we do need them to, go see their GP, speak to their GP. The GP might be able to offer them help straight away, and not have to go to the hospital. But the sooner you get help, the better, because we know once these symptoms become more established, it's much harder to manage them. As far as the children's service is concerned, we now have a children's pathway, and in Yorkshire and the Humber there are 5 specialist assessment centres. Our local one is at Leeds, but any child, again, who has the symptoms that we're talking about, so that might be fatigue, but it might be rashes, it might be the loss of the taste, it might be quite commonly, I think, things like diarrhea and sickness or joint pain. They do need to visit their GP. Again, we want to get children and adults to come forward earlier rather than later, it might be that a parent notices that the child's very tired, but then they pick up for a few days and they think, oh, it's okay, and then the next thing they're tired and fatigued again. But again, it might be a rash, it might be pain, there's lots of different symptoms that it could be, and we really need people to come forward. So if a child comes forward at the moment, they will be referred first of all to Pinderfields, to the consultant paediatrician there, and they will look at those symptoms to decide whether those symptoms are possibly COVID related, and whether there's anything that they can that they need to refer on to Leeds, or whether it can be managed locally. For both, sorry, can you go on to the next slide? Oh, go to the next one, sorry, go to the next one. That's it. For both adult and children's symptoms, some of the most successful things are actually things that we can do through our community and voluntary services. So we've got Live Well Wakefield. Live Well Wakefield are offering support for people with long COVID, I've got 3 little leaflets here. One is looking at breathlessness, and they've been providing, Liverpool Wakefield have been providing support for people with breathlessness for many years. So if you look at something like COPD or chronic bronchitis, that they've been providing that. It's evidence-based, and it does work. We've also got the tiredness, that fatigue. So it's not really tiredness, it's much worse than tiredness. That's a poor analogy really, but that fatigue management, they've been doing that for a number of years. And then they also have some specific support for people who do have, the GP has said it's long COVID. We mustn't forget your COVID recovery, which is also there, and that's the online option. And now we also have this, the offer of singing. And again, that might sound a strange thing to do, but we know, and we've worked with Shared Harmonies for many years, particularly in Wakefield, but across, much wider across West Yorkshire and Harrogate, to provide evidence-based singing sessions for people who have diagnosed respiratory disease. And that could be people with, very severe illness causing breathlessness, but that breathing exercises and breathing training to be able to sing and to take part in the choir, we know is really, really successful, and we have great outcomes for it. Nationally, they've been doing work with the English National Opera, which you might see on the telly. But I'll be honest with you, our service is just as good as any English National Opera, so we're sticking with them. And as you can see, Leeds and Bradford are doing the same. We also do have options through IAPT, and we have options to be able to help people to decondition is something that is a word that people decondition because they haven't been out and haven't been able to exercise and haven't been able to do things, so their muscles get weaker. So we're working with Aspire and the council, gym instructors, at the local places like I was going to say Lightwaves, and that's how old I am, at Thorns Park and others, to work with people to recondition them, to strengthen their muscles. Now, this isn't suitable for everybody with COVID. They have long COVID or post COVID. They need to have an individual assessment to see if exercise is a good thing for them, because often with fatigue, the last thing you want is exercise. So that would be following an assessment either by the GP or by the post COVID assessment service. So if we go back to the slide before, please. I've got them the wrong way around, sorry. So in Wakefield, what we've got is all of our GPs have signed up to what's called an enhanced service specification. And basically what that means is that NHS England has asked all GPs in the country to sign up to say that they will do more to identify and manage people with long COVID. And every GP in Wakefield signed up to it. We've got a really positive response from our GPs around looking for and identifying people with long COVID. But what we need is people to be turning up and to be, saying, I've got these problems. So when we find somebody, we direct them to Your COVID Recovery, which is the online tool. And again, I have to say, it's not for everybody. They're developing a separate children's piece of work at the moment. So there's access to children. And if someone is fatigued, or that might mean that they really find it difficult to look at things online. But it's an amazing resource either for the person or their family to get ideas about how to help them. Recovery time is different for everybody. So some people will be better after 12 weeks, and they'll never need to go anywhere else. But and it's making sure people have that hope that they don't think they're stuck with this forever. But it can happen to anybody, and it could happen to somebody who didn't even know they had COVID, especially with children. So in these COVID times, anyone with some of these symptoms will be considered as a potential person who can have post-COVID. And again, it's that unpredictability of those symptoms. Now, we're getting reports from people with long COVID or post-COVID to say that they are still being gaslighted, not believed. I think I've got a bad back, and it's at times I can literally not get out of bed. It's agony, but people can't see you and they can't see that, and it's something that it is a very physical thing. I can find it on an MRI scan that can point to where the problem is, but you know, people might always not believe you or think you're swinging the lead a bit with your bad back. So I think it's a bit like that, really, that these people are finding it hard to be heard and believed. And I think we really need to make sure that as a community we support, you know, we support people and believe them when they tell us about it. Especially with this ever changing, and one day you're all right and the next day you're not. We are looking to provide that information around self-management through Live Well Wakefield, but we are looking for other ways to do that. And I'm very, very keen to identify ways to do that, particularly with children, self-care, self-management, community support for parents, support for support for people with those symptoms. If it's not a, you know, even if you don't call it long COVID, but you know, if anyone's got any ideas about what we could do or how we could support people better, that, you know, there's not a lot out there outside of what what I've shown you today. So please, you know, come forward with ideas. Provide information to look at on symptoms. Again, we're finding it quite frustrating because we haven't got information coming in from NHS England or others, but we are told it will be with us very soon. So again, it's down to us to talk about long COVID, really, and to make sure we share the information as much as possible. And just to say, we are, you know, if you admit to hospital, you do get a follow-up, and we're trying very hard to make sure that this is very focused on the individual, because it's not the same for everybody. You saw all those symptoms. It's not the same for everybody. It's very different. While there's these two main groups of the fatigue and the breathlessness people, there's a whole host of stuff in between and other stuff going on. And it is really about hearing people and believing them, and also reaching into communities where perhaps people aren't aware of this, they haven't seen this, or maybe something like this sort of, you know, the fatigue stuff in particular isn't something that community will see or be supportive of. And it's about making sure we're reaching everybody. So I think that is it. If you want to go through to the end, I've got some contact details there, I believe. There you go, that's me, but Kerry can always find us.
Thank you, Lisa. That's really interesting. We've had a couple of questions. One I think you've answered, which is if somebody thinks they've got long COVID, what should they do? And I think you've answered that.
Yeah, definitely go back to the doctors. If you think you've got long COVID, go and speak to your doctor. If you think it's long COVID but you want to do something around self-management, go to your COVID recovery, definitely, but go to the doctor as well. Yeah.
And there's another message there.
Yeah, so that's about funding. So Paul, if you've got some ideas, please get in touch, because at the moment I am looking to try and find funding for things. We've just had some money from NHS England. Unfortunately, that really had to be focused towards the medical treatment, because, you know, we didn't have a physiotherapist, we didn't have an occupational therapist, we didn't have a dietitian or speech therapist who had time to deal with some of this stuff, and we needed consultants, a consultant to be working with us as well. And as you can imagine, that money went really, really quickly. But we are looking at funding other things. So if you've got ideas, please come and tell me about them, and then I will do my utmost to find somewhere that we can get some money from.
Thank you. And I think that's something that outside of this meeting, maybe those of us with a community focus could have a conversation about how we can support this going forward, Lisa, because as it looks from your presentation like this is going to be an emerging area. I'm particularly interested in people who might be experiencing fatigue or other symptoms that might not be picked up for a number of reasons, might not feel that they can rest properly because they need to go to work and they don't have very good sick pay or terms and conditions. There's a whole range of people I'm thinking, you know, it would be really good to involve and include. And thank you, Amanda, for also saying you can support this. It's something I think we could look to work with our funded COVID community champions as well. We're absolutely on time to finish, so I'll aim to finish, unusually for the last few times, on time, unless anybody's got any further questions or any comments that they want to add. Okay, so just to let people know that I know we'd put some dates in the diary going forwards, and we are looking at continuing with our once every 2 weeks model going forwards over the next few weeks and months, probably a shorter meeting of half an hour and a longer meeting as well. We're still really keen to hear your questions, hear your comments. There's new information coming out yesterday, so please do keep informing us and letting us know, because we always use that information to kind of imagine what we might need to be doing over the winter as a group of partners, and absolutely want to include you in that. So thank you very much for coming. Please do keep in touch, as I say, and we'll see you in a couple of weeks. Thanks. Do presenters want to stay on the call for a minute?